Karleen GRIBBLE, Bachelor of Rural Science and Ph.D, is an adjunct associate professor at the Western Sydney School of Nursing and Midwifery. She is here with us today to give us a brief outline of the health professional conference she will give in Paris on the 30th of March, as well as the topic of her conference on the 1st of April in Paris here for the International Day of Breastfeeding. She has headed and published a lot of research on breastfeeding, much of which has led to World Health Organization recommendations. Her research has covered subjects such as breastfeeding adopted children, the impact of full-term breastfeeding, child protection and breastfeeding, peer-to-peer milk sharing and donations, and some of her research has led to care models for traumatized children. One of her research topics has identified the key points to successful support and information to mothers affected by crises or emergencies to enable them to continue breastfeeding, which is what she's going to be talking about at the International Day of Breastfeeding in Paris on the 30th of March and the 1st of April 2016. Thank you, Dr. Gribble, for joining us here today. We're very much looking forward to hearing you in Paris on the 30th of March and the 1st of April.
Oh, thank you so much. I'm really looking forward to it too.
Your topic, breastfeeding in emergency situations, is particularly pertinent at the moment in France and many other European countries, with massive population movement. The majority of this massive population movement are young families, the mothers of which are breastfeeding. Our healthcare professionals in France are acquainted with the difficulties in providing efficient support to breastfeeding mothers in dire straits because for a substantial part of the French population, every day is an emergency. And though breastfeeding the baby is probably as priority as it is for any given French mother, education and support to mothers living in dire straits, whether temporarily or permanently, on the value of breastfeeding and how to succeed is a direct contradiction to the glamorous marketing message they get bombarded with from all directions. A large part of the problem in addressing and informing that segment of the population is the obligatory training on infant feeding offered by the world's biggest manufacturer of human milk substitutes to future pediatricians here in France. What research are you bringing us that can give healthcare professionals the best tools to educate and support the mothers breastfeeding their babies in emergency situations, regardless of whatever source their initial training is from?
Yes, it's a very good question, and it's something that's indeed really important. I think recognising that mothers who are in stressful circumstances, regardless of what those circumstances are, whether it's a humanitarian emergency like you're experiencing currently in Europe with the migrant crisis, or whether it's a mother who's in poverty or a mother who's experiencing domestic violence in her home and doesn't feel safe. For all of those mothers, breastfeeding can be such an important thing in protecting her child's health, in protecting the relationship between the mother and the child, and enabling the child to have a healthy future. So providing the right sort of support for those mothers is really important. The thing is that we actually know what helps mothers in those circumstances to be able to breastfeed. And that's what I'm going to be talking about at the conference. So it's about the sort of practical things that can assist mothers. It's about the sort of support that health professionals can provide to them. And it's also about what not to do, because as you identified, there are organisations and businesses that have a vested interest in how mothers feed their babies. And sometimes that can have quite a negative influence on them and their ability to breastfeed. And so those are all things that I'm going to be discussing.
Can you tell us if there are rules of laws or any particular rules that have been established clearly about advertising human milk substitutes to women who are living in dire straits, who are living or going through an emergency situation?
Well, we have, there's actually quite a bit that's to do with the marketing of infant formula and other breast milk substitutes in emergencies. The International Code of Marketing of Breast Milk Substitutes applies in emergencies, so all of the aspects of that code are still enforced or should still be enforced in emergencies. And we've also got a number of other instruments like the infant and young child feeding in emergencies operational guidance and the SPHERE standards on minimum humanitarian aid that also talk about
the what standards?
SPHERE standards. So they're an international, it's an international agreement, I guess, on what the minimum things that should be done and not be done in a humanitarian response. And they also address issues that are to do with the marketing of infant formula. So, for example, they all say that donations of infant formula and other breast milk substitutes shouldn't be made in emergencies. And there's good reasons why that's the case, because where milks, not just infant formula, but any milks really, are donated, they will be distributed because they're quite high value products, and people have many people have the idea that it would be helpful to mothers to give them infant formula or other milk for their babies. And so they're distributed, and where they're distributed, they will be used by mothers. And we know this because it's been measured in many different emergencies. And so protecting mothers from being given donations that they don't need and that they might use and so harm their babies, because in humanitarian emergencies, we're looking that the harms will include deaths and will include increased morbidity due to diarrhoea and respiratory tract infections, which is certainly something that's being experienced in Europe currently. It's just one of the things that we know we should avoid at all costs, really. And that doesn't mean that there's not a need for infant formula to be distributed in emergencies, but it needs to be distributed in a way that it's only given to people who really need it, and that the mothers and caregivers that are provided with infant formula are also provided with other resources to enable them to feed their babies with an acceptable level of safety. Because there's no point giving them infant formula if they don't have access to water, if they don't have access to healthcare, if they don't have access to the other things that are necessary to ensure that their baby's going to be okay.
Yeah, they would need to have a minimum of hygienic equipment, circumstances to ensure the safety of feeding human milk substitutes.
Yeah, that's right. And that's very difficult to provide in an emergency, which is another reason why making sure that infant formula is not distributed indiscriminately is so important. Because if it is distributed and if women use it and they didn't really need to, then the risk that they're placing their babies at is really very high, because they just can't guarantee supply, they can't guarantee that they're going to be able to clean their feeding implements. If they're using a bottle, that they're going to be able to clean the bottle, or they're going to be able to clean the cup or whatever it is they're feeding their baby with. It's really quite a precarious situation that the mother and baby are both in, because for mothers, they love their babies. They want good things for them. And there's nothing more difficult for a mother than having a baby that's crying and hungry and not being able to feed it. And so we need to make sure that our aid efforts help mothers and don't harm them, that people don't provide aid in a way that they think is helpful but is actually going to hurt people.
I think that's the point. It's by giving human milk substitutes, it is perceived by everybody everybody who doesn't know what's going on, that it's really helping the situation, and it's a great generous thing to do.
Yes.
Unfortunately,
people think they're being kind.
I know.
But in fact, it's often being cruel. And it's also, unfortunately, it's also something that manufacturers can take advantage of sometimes. So because the general public believe that it's being kind, when they trumpet or advertise the fact that they've given donations of infant formula or other milks to aid efforts, it's perceived as being a good thing, when in fact it's a harmful thing.
In France, there are a couple of times a year, there are collection movements, organizations asking the public to buy human milk substitutes to help people living in dire straits in France.
Yeah. Yes.
Right. So do we agree then that the most important thing in effective support to mothers living in dire straits, whether it's permanently or temporarily, the most important thing that we should be giving them is information and support in succeeding at maintaining breastfeeding?
Well, that's part of the picture. So we were talking about protecting them, making sure that they're not being given donations of infant formula. I mean, it's really hard. I know in Australia, pretty much everywhere in the world, I'm sure it's the case in France, infant formulas are an expensive product. People find it really difficult to throw out. And so when there are donations given, and the donation drives that you spoke about, what ends up happening is there will be women who might need infant formula for their babies and who might benefit from being given it, but the donations won't be of the sort that is needed universally. And it's the case in all emergencies. Donations will not be in the amount that's required. They won't be of the type that's required. They won't be in the place that they're required. And they'll very often be unsuitable for use. So donation of expired infant formula is an issue, donation of specialty infant formula is an issue, donation of toddler formulas when you actually need starter formula for newborn babies, that's an issue. So there's those aspects, but then there's also the aspects of providing support for women. So ensuring that in hospitals, mothers and babies aren't separated so that they're able to get breastfeeding off to a good start. To ensure that the people who are caring for the mother and the baby are able to help the mother to interpret her baby's communication to her so she's able to understand her baby and respond to her baby, and to value that breastfeeding relationship. So to value what that gives the baby, not just in terms of food, but what it gives the baby in terms of promoting a good relationship between the mother and the baby. Because we know that breastfeeding actually supports the mother in a number of different ways. Hormonally, it makes it easier for her to feel good about her baby and to feel less stressed. And we know that mothers who are less stressed are able to be more responsive to their babies. It also promotes her physical proximity. So a mother who is breastfeeding finds it more difficult to be distant from her baby. And so that promotes the relationship between her and her baby because there's more opportunity for that relationship to develop and grow. And particularly for very vulnerable mothers, for mothers in very stressful circumstances who can find it difficult to respond to their baby in a loving and caring way, that underpinning of hormones and relationship development that they get through breastfeeding can actually make the difference between her being able to provide an adequate caring environment for her baby and not being able to do so, providing a neglectful environment. So we know that mothers who don't breastfeed or who breastfeed for a very short period of time are more likely to neglect their children in the long run. So supporting that relationship is actually really, really important, and more important the more difficult the circumstances the mother is in.
And research has shown that then. We've got research-based statistics on that.
Yeah, absolutely. So we know from, for example, from when the Baby Friendly Hospital Initiative was started, that in hospitals where they went from having mother-baby separation and low rates of breastfeeding and those sorts of things, that when they implemented the Baby Friendly Hospital Initiative, that rates of child abandonment decreased in a variety of countries. So not just in one place, but, across the world, that was something that was observed. I've got a very large study that was carried out in Australia that looked at rates of abuse, like substantiated abuse and neglect in children up to the age of 16 years, and found that women who had not breastfed or who'd breastfed for only a few months were much more likely to neglect their children in the long run. And it's not surprising, because we've also got a heap of research that shows that mothers who are breastfeeding tend to be, and it's not saying this is what happens with any individual case. We're looking across populations. It's really important to understand that. It doesn't mean that someone who's not breastfeeding is going to abuse or neglect their child and isn't, will not have a good relationship with them. We're looking at what supports across populations. And we know that mothers who are breastfeeding tend to be more responsive to their babies. They tend to want to be more physically close to them. We have loads of observational research, and we also understand the mechanisms behind why that might be the case. It's just one of those things that I guess has been undervalued, and not recognising the important role that can play. And I guess it also underpins the need to provide additional support to mothers who aren't breastfeeding, especially when they're in stressful circumstances, to ensure that doesn't happen, to help them be the best possible mother they can be, because it's a hard job for all of us. We all need all the help we can get.
Yes. I think there's a very big misperception all across the world, and that is, breastfeeding is so difficult. Whereas in reality, becoming a mother is the most difficult thing. Breastfeeding takes a learning period. There is a learning time involved in breastfeeding for sure, but it's becoming a mother that's so difficult. And I think if everybody were properly supported and properly informed and succeeded when they choose to breastfeed, I think everybody would agree that breastfeeding makes mothering and parenting so much easier than not breastfeeding.
Yeah. I mean, it depends on the circumstances, but indeed having the right sort of support and assistance when you need it from people who respect you and respect the decisions that you're making, I think that makes a world of difference. And unfortunately, for many mothers, that's not what they experience.
Yeah.
There's no point in telling mothers you should breastfeed and then actually not helping them.
Exactly. That is it in a nutshell. Okay, well, thank you very, very much for everything you've said now. And thank you very much for agreeing to come to France to speak on these very important topics. I think if your research was known all over the world, I think we could probably change the statistics on a global level.
Well, it's not just me by any stretch. There's lots of people doing fantastic stuff out there, and word is starting to spread about how important it is to support mothers and caregivers and babies in emergency situations and in stressful circumstances. The more we talk about it, the more we know about it, the better a job we can do. And I think they deserve it. They really do.
Yeah. Well, thank you very much. This is fantastic. Looking very much forward to seeing you at the end of March and beginning of April in 2016 here in Paris. Thank you.
Wonderful. I'm really looking forward to it.